portal. So the portal is pretty standard for any portal that out there with EMRs. We're using it for follow-up progress messages, both from the clinician and from the patient. And we would do a lot of tickler messages. So we would predate our message to the student for a week, 2 weeks, a month out, just to be sure that things were going well and that we did not lose a patient to follow up. We also run all our refill and documentation requests through our portal, and we share all lab and imaging results through our portal. So the patients are very familiar with that, but what was new for them was to actually be able to view their notes. We use the portal as well for screening tools, for appointment reminders, the patient education materials, reminders about health maintenance and immunizations, and then addressing any new concerns that come up. The patient has access directly to providers through the portal so that they can ask a question of a provider, either about a former visit, or if a visit's coming up and they have things that they want to be sure that we address in that visit. So this is just a review of what OpenNotes initially discovered, that in fact it was a very positive thing in their trial in a variety of centers where they really found that patients were responding very positively to being able to review their notes, that they were taking better care of themselves, they had better understanding and comprehension of what was going on, they felt more in control of their health care, they were better prepared for visits. And in fact, we invite our students to write to us ahead of time with their concerns that we can enter into the subjective part of their notes, so that in fact the student is helping to write part of their medical progress note. Other OpenNotes data that also was extremely convincing, and was very convincing for my staff, that this was going to be a positive thing for the patient and for patient care, so that there was in fact good reason for us to take this initiative and start sharing our notes. So the question that always comes up with clinicians is, okay, how is this going to impact my flow, my timeline for getting patient visits done? Is it going to increase my workload? Will my day be longer? And I actually timed myself as I was starting this, and I was seeing a variety of general patients when I first started this. And then over the last 4 years, I've been exclusively behavioral health because of the demand for behavioral health care. Even though I'm a primary care physician, I am seeing somewhere in the neighborhood of 15 to 18 behavioral health students, both new evaluations and follow-up evaluations every day. And so I timed myself to see how long does it take me to actually send a link to the note to the patient. So we don't automatically give the patient, under our current EMR, access to all notes. We actually have part of the file that is exclusively for patient review. We put the notes in that patient review folder, and then we send a link to the student after the visit, usually within 15 minutes after the student has left their appointment. They will receive a notification through the portal that they have a medical note to review. And so they can go in and they can review the note. It would take maybe 30 seconds for me to create that link and to write whatever else I wanted to say to the student in a portal message about the visit. And so it really did not impact my timeline in seeing patients during the day. I did feel strongly, and I urged my staff to get their notes done right after the visit, so that the link to the note can be sent out immediately. And obviously there are some days where that's just not possible. You have to finish your note at the end of the day, and that's when the reminder links go out to the students. We did notice, I mean, I noticed it right away, and so did my clinicians, that we are not using as much jargon, medical jargon. We're spelling out abbreviations and acronyms. We're being a little more conscientious about how we are writing our note, in the sense that we want it to be understandable rather than just shorthand. And so that takes a little bit of forethought, but once you're used to writing your note in a way that's really meant for the patient, it actually flows very, very quickly. So we noticed some benefits right away, and we started introducing other clinicians to this process within about 6 months of my starting it myself. I was able to get the other family docs and primary care nurse practitioners to start sharing their general visit notes. I would say it was a harder convincing to get women's healthcare nurse practitioners to get started with this. They felt that sometimes the things that are pretty sensitive in a sexual history might be difficult for students to read, and I reassured them that I really felt that the student who was giving them the history to begin with was not going to have a problem with reviewing the history that they had provided to the practitioner. So women's health came on board next, and then last was the psychiatric providers. And the psychiatric providers, which includes a nurse practitioner as well as psychiatrists, have opted for the most part to just do assessment and plan sharing rather than the subjective objective. And I think that's fair. My behavioral health notes are completely shared. The only times when I may decide to just share assessment and plan is if I have a student who's extremely paranoid or psychotic, and where it's potentially triggering for them to see some of the history that I've recorded. But for the most part, any of the people that I'm seeing, and I'm seeing the full spectrum of mental health in my practice, you know, everything from bipolar diagnosis, to psychosis, to major depression, to OCD, to eating disorders, as well as access to diagnoses. If I've explained my diagnoses to the patient verbally in the meeting, I feel like they are prepared to see the information in my note, and I truly have had no concerns or problems with students either objecting or being offended or somehow unprepared to see what I put in my notes. The psychiatrists are a little harder sell. They really feel like they want to just have assessment, and so the assessment and plan, treatment plan, shared with the patient. But I think that will be changing probably over the next year. So our benefits, we're definitely getting fewer phone calls from students. Phone calls have dropped off dramatically. We definitely have fewer records requests where students are requesting records for themselves. They're able to download everything from their chart themselves. And there's not as much documentation, so that we really are doing it all through the message portal, so that we're not having to translate a phone call to a progress note, or a text message to a progress note. And this also allows students, if they opt to share their records with family members or other health providers, if they want to do that. And so that's something that students are doing frequently. So depending upon the EMR, and we have yet to see exactly how this is going to work in point and click, there are places in the EMR where you grant permission for a patient to view certain parts of the chart or all the chart. And we, as we set up point and click, I'm sure we're going to be looking at how to do that so that it's automatic, that a student can see what we want them to see and when we want them to see it. We don't want them reviewing labs and imaging reports before we've reviewed them and signed them off. We, in our current practice partner EMR, we set up coding in our progress note templates so that we could determine what part of the note would be reviewable. So that's how the psychiatrist could only share a partial note. And then we would send a message to the student through the portal saying that there was a note ready for them to review. And then we were very curious about how many actually reviewed them. A couple of other things. You know, it's important that students have access like this because often they are upset or nervous, scared, or they're feeling terrible. And so I don't think that's me. Interference here, so I just keep going. So anyway, even if patients are symptomatic, they really can value receiving their notes later on to what happened during their time in our clinic. So we would have the ability to see who actually opened their notes to review their medical notes. And so we had a red receipt from our students that opened their note. We would get a message back that they read the note, and we would actually document that in the chart that the note had been read by the patient, so that we know that message had gone full circle, that the patient actually had the information that we wanted them to have. If the email or the link to their message goes unread after a week, we would send them an email saying, you still have a message that's unread. And so a certain number of people would then be reminded and go in and review their note. And if they had not read the note within 2 weeks, then we have staff actually call them, leave a message saying you have an unread message. And so given that reminder system, we actually see more than 90% of our portal messages are read within a month, which is a pretty astounding read rate. And so we will persist in that kind of reminder system. So an email after 1 week, a phone call after 2 weeks. And my understanding is through point and click, potentially we can do a text message securely through the EMR. So we may do a text message reminder so that we know that our students are actually opening their messages. How carefully they're reading them is another issue, but at least they are opening the messages. So these messages are not just being ignored. So just to review what kinds of issues came up from our clinicians, clinicians worried that they may not document as honestly, knowing that the patient's reviewing the note, or maybe they wouldn't document with as much detail, that maybe the patient was misinterpreted, offended by medical jargon. Would patients demand changes to the record if somehow we didn't get history right, or if we said things in a way that they did not want in their record, or would they become upset or worried? And to be honest, with these concerns that came up, I think people are using a little different style in documenting things. For instance, if a student came in with considerable dishevelment and terrible body odor, and rather than documenting as we might previously say, where we would just flat out say that they were disheveled and had body odor, we might couch this in terms of challenged by self-care, so that it's not quite as inflammatory or triggering if it's read by a student who's really, really struggling. So that we're still documenting in a way that I think means something to other providers, but not as triggering or inflammatory to the patient themselves. I don't think that we're documenting with any less detail than we were before. Students sometimes will ask, what did you mean by this or that detail, especially anatomic details, and we can respond to that. And we have not had anybody who has gotten back to us saying that they were offended by something that we've said. We have had people say, you didn't get that history quite right. Here's how it really happened. And so we will put an addendum in the record whenever there is a need to change something that the patient feels is not accurate or doesn't reflect accurately what they told the clinician. We will add an addendum with the wording that the patient is asking. We don't strike out or change our original note, but we will add the addendum to the bottom of the note, indicating that this is what the patient has said. So it has been remarkably problem-free. And so clinicians now here, after 4 years, are big supporters of providing this information to students. So as I said, the psychiatric providers are at this point opting to do just partial note review, but I think working with them and with my own experience with behavioral health patients, I think I've got them to a point where I think they're going to be more comfortable sharing the complete note. And I guess what I would say, after 30 years in college health, and I was in primary care practice prior to that, this has actually been an exciting time in medicine for me to be able to look at the chart in a different way, to look at it as a real tool, communication tool that I don't think we've ever had before, where we are truly partners with the patient, and we are seeing our communication as being really a two-way street with the patient via the EMR, which is an exciting time in medicine compared to how it has been. So this is actually my sign off in terms of my part of the presentation, that we are hoping that these emerging adults, these students who have so much time that they spend online in every other way, that this is actually going to help them become better consumers of healthcare in the future, that we are preparing them to actually do exciting things in their own self-care while we are initiating this at this time of their life, their first time where they're really out getting healthcare on their own. So I appreciate you listening, and I'm going to be hanging around for questions later.
Thanks, Emily. So Julie and Suzanne, feel free to share your screen and talk a little bit about OpenNotes and your study at UMass Boston. And Julie, you might be on mute if you're speaking. So just unmute.
I think it's actually Suzanne who's on mute. Suzanne?
Hear me?
Yeah.
Can you hear me now?
Yeah.
Okay. So I'm Suzanne Leveille. I'm an epidemiologist and a nurse, and I've been involved with OpenNotes from the beginning, around 10 years ago. Nice slides. There you go. Thanks. It's like a delay here.
Use pick up and page down.
Okay, to tell you a little bit about OpenNotes, it began with a 3-institution study in 2010 at Beth Israel Deaconess Medical Center, at Geisinger, and Harborview Medical Center, as Emily had mentioned. We started with 100 PCPs and 20,000 of their patients. It's now a national movement, and I'll talk a little bit about the dissemination at the very end. Our first study with the PCPs, we found that only about 2% reported that it had an impact on their visits, 3% reported that they were spending more time on patient questions, and about 11% reported spending a bit more time on documentation. So in sum, it had much less of an impact on workflow than people had feared initially. Also, we found that messaging and emails to providers didn't change. There was a good deal of concern by the providers initially that the patients would find the notes confusing or offensive, or else it might even make them a bit more worried after reading what the providers were thinking, but very few patients reported that when we surveyed them. Between 1% and 8% reported any of these concerns in the follow-up survey. So to talk a little bit about what our results were from a large patient survey at the start of OpenNotes, 82% of the patients who were portal and had access to the notes had opened at least one visit note. And at least 3 out of 4 of them had reported a number of benefits from reading the notes, including that they felt they were taking better care of themselves, understanding their health and their medical conditions better. They felt more in control of their care and feeling better prepared when they came to visits. And also, a number were talking about having better understanding of their medications and were taking their medications as prescribed. In sum, from these initial studies, we found that 99% of the patients said they wanted to continue OpenNotes after they were first given this opportunity. And 85% of the patients said that having the availability of their visit notes through the portal would influence their choice of providers in the future. And at the end of the 12-month study, we gave the PCPs an option and asked them whether they would want to turn off OpenNotes, and not one of the participating PCPs selected to stop. And subsequently, all 3 health systems that were participating in the project made a decision to implement OpenNotes institution-wide. Another aspect of opening the notes of the patients has been that it's improved patient safety. And these are just a couple of quotes from patients that had given us, but we also know from a number of surveys that many patients have found errors in their notes, some of them rather serious errors that they were able to bring to the attention of their providers. As these examples, one patient had said that if the notes had been available years ago, they would have had their breast cancer diagnosed earlier, that the doctor had written in their chart and marked the exact area but had never told the patient about it. So this patient said they felt that opening notes could potentially save lives. And PCPs have also reported that they feel safer knowing that patients are also looking at their notes and able to verify or make corrections as they find them. More recently, we've done additional surveys now that many patients have had access to notes for 7 or more years, and providers have had extensive experience where the notes have been opened for all providers in these 3 systems. And also we have a recent paper about medication. So just to summarize some of these results from our recent surveys, they were similar to the initial results where patients were reporting a number of benefits that they experienced from reading the notes. In a recent survey, we found that patients that were older and those of racial minorities, patients with less education, also patients who were non-native English speakers were more likely to report benefits of note reading in relation to taking better care of themselves, remembering their plan of treatment, and feeling more in control of their care, and also in preparing for their office visits. One thing we found initially on the first surveys, about 20% of patients had said that their providers had encouraged them to read notes. In this more recent survey, 7 years later, we still only had about 1/3 of patients reporting that providers were encouraging them to read their notes. We did find in this survey that patients who were encouraged to read notes had read more notes. We have another recent paper that we've done looking more specifically at this issue of medication adherence, which could have also an impact on student health and students having access to their records. Patients had reported that reading their visit notes helped them to understand why their medications were prescribed. It helped them feel more in control of their medications, and it answered questions about medications. There were a number of other ways that reading the notes helped them feel more confident about their medications. One other point I wanted to make: a while back, we published a paper showing what happened when the notifications were stopped. So at the Geisinger, after we did the initial pilot, they had turned off the notifications, and we saw a drastic drop in patients reading their notes. Whereas at Beth Israel, we continued to have the notifications, and after our initial studies ended, patients continued to be opening their notes. So this is just really to drive home the importance of providing these notifications, which Emily was also talking about their efforts at Western Washington and how important it's been there. Lastly, I wanted to mention that a year ago in March in 2018, we had about 20 million patients that had access to visit notes. And on our latest count, we have 40 million patients. So there's a big surge of late with many more patients having access to the visit notes. In this particular map, for example, it shows the teal color are states where more than 10 institutions in those states have open notes. And you can see, according to the key, with the states with the really dark purple, there are 6 to 10 institutions that have open notes. And all the states in the country now have at least 2 or 3 institutions that have open notes. So it's just to indicate the popularity of open notes and how fast this is catching on at this point. So that's all I have. I'll pass over to Julie Wright, who will talk about our work that's been going on over at UMass Boston.
Okay, thanks, Suzanne. Okay, everybody hear me?
Yep.
Good.
Yes.
Hi, my name is Julie Wright. I'm from UMass Boston. I'm a behavioral scientist from the Department of Exercise and Health Sciences. My research is in health and physical activity promotion and behavioral informatics topics, such as using technology to promote self-management of health and healthcare. So today I'll talk about engaging emerging adults or students in their own healthcare. So Suzanne and I have done 2 studies here with emerging adults. The first study I'll talk about just briefly is a mixed method study that we did back in 2014, 2015, and then a cross-sectional study we did more recently. And we've done these studies with collaborators. The mixed method study was done at UMass Boston and UMass Lowell, and the cross-sectional study was done with a health communication expert at Bryant University. So with the mixed method study, the first study, we explored the attitudes and opinions of University Health Services or UHS providers and university students. So this study is giving you more of a perspective from what students think as well as the providers. And this is asking providers who have not had experience with OpenNotes and students as well having no experience. So in the study, we did qualitative in-depth interviews with both the students and the providers. And we also did a quantitative survey at the end of the study, asking students about their attitudes and opinions to accessible healthcare records. And you see the reference down at the bottom as well if you would like to read more about this study. So just briefly, when we interviewed the providers with qualitative research, you kind of get these themes that come out of the interviews. And we had asked them about what their thoughts about providing open notes. And one of the themes that came out of that was that providers seek to develop and preserve relationships with students via good communication. So as you can see, these providers really wanted to preserve the relationships that they have established with their student patients. The providers tended to use verbal instead of written communication, and they did use email and phone to get the students' attention about follow-up. And really a large takeaway from the study is that the University Health Service providers see themselves as teachers and navigators. With the students, the themes that really came out from this study is the students' desire for control over their health. Influences how they manage their health and their healthcare in the healthcare system. So when one of the sub-themes of that is that students gather information about their health, and the first place that they go is to the web. The next place is to their family, and then the last place they go is to their provider. When we were talking to them about student accessible healthcare records, they really liked that idea, and they thought it would help provide insight and involvement in their healthcare. So just to compare, this slide is comparing 3 studies. So the 2 studies that are the OpenNotes studies are the ones that Dr. Leveille was talking about from Delbanco, Walker, and Leveille. They asked providers and they also asked patients about their attitudes. So some of the things you've already seen here, the percent of patients who agreed that making visit notes available to patients is a good idea. 94% of OpenNotes patients said that. And I believe that was before they actually opened the notes. And Suzanne, you can chime in and correct me on that one.
That's right.
Is that right? And then 80, and the same thing with the providers or the PCPs, 81%. So just to compare those percentages to what the UMass Boston and UMass Lowell students said, about 85% of the students said making visit notes available to the patient is a good idea. And again, these students didn't have OpenNotes at the time. And they also said 93% said patients who read notes will better understand their health and medical conditions. Now, the last column over is another study that was done at the VA. So that's the big blue button. And they asked similar questions. They didn't ask the first question, but the next 3 questions they asked. And you can see that the students line up with not only patients from the VA, but also patients from the 3 healthcare systems that Delbanco and colleagues have studied. So very similar to there. So the second study, the more recent study we did, is a cross-sectional survey study. And this was done in collaboration with Bryant University. So we're interested in emerging adults who are 18 to 29 years old. The purpose of the study was to describe the usage of different online portal features among the emerging adults. And the students were enrolled either at UMass Boston or at Bryant University. So they're very different universities. UMass Boston is a majority minority campus, and Bryant University is a small private university. So we did this online survey. It was it was a link through Qualtrics, and most likely the students did it on their mobile devices, but it was set up for mobile devices and desktop. When some of the questions on there were asking about their healthcare and where they got that. And then we asked, does your healthcare center offer a secure online patient portal? Yes, no, not sure. And then we asked another question, have you ever used a patient portal for the following reasons? And we gave them 8 reasons to use, 8 reasons that they could select from. And that was check immunization records, check lab results, email my health provider, check my appointment date or time, request a refill, read my visit notes, or often called doctor's notes, and post my own health information on the portal. So the results of this online study, we had a sample, an analytic sample of 340 students. 76% of them were female. 80% were between the ages of 18 and 23 years old. 66% were white, and 61% were on their parents' health insurance. So only 54% of these participants reported that their center offered a patient portal. Now, this doesn't mean it could mean their university, it could mean wherever they're getting their healthcare, so they could get it at a major healthcare system outside of the university. 85% reported using the healthcare system in the last month, which I thought was pretty high. You can see we have a good percentage, or a very small percentage, that had no visits in the last 15 months. And then under the 54% that reported that their center offered a patient portal, 54% said yes, but 34% were not sure. And of course, this is an online self-report survey. We have no way of verifying whether they had one or not, but only 12% were certain and said no. So of the results, of those who reported having a patient portal, only 23% said they didn't use it. So there's a large percentage of emerging adults who are using their patient portal. The most used features of their portal was checking lab results, appointment time, and immunization records. And those kind of make sense if you can think about what emerging adults want to do, and also the need to have immunization before registering for classes. The least used features were emailing the provider, making an appointment, reading the visit notes, etc. So I just bolded reading the visits notes. 23% of those said that they were reading it. We don't know where they're reading it. It wasn't at our healthcare center because we don't have OpenNotes, but they're reading it somewhere. And I also want to point out that there's a large percentage that are using 2 to 4 features. So 31% are using 2 to 4 features of that list that is on the screen. So overall, about 41% of the entire sample, so the 340 people, are using some aspect of the patient portal. That leaves about 60% who are not using anything. And that means that, to me, that emerging adults really don't have the experience with using a patient portal. And that could be that they don't have access to a patient portal. In the Boston area, in the Massachusetts area, though it tends to be more common these days. So just to kind of sum up what we're thinking about next steps is exploring how to prepare and empower emerging adults. We want to evaluate the impact of OpenNotes and what that has on an emerging adult population. For example, how will it affect patient engagement? How will it influence future patient self-management? And we'd also like to explore how to facilitate usage of self-management tools, such as reading the OpenNotes and other patient portal features. And with that, I'll just close. And I guess, Jeff, do you want to take it from here?
Sure. Thanks, Julie. And thank you, Suzanne and Emily, as well. So we're going to open it up to Q&A now. Feel free to use the chat function or just unmute your mic and start talking.
Chat bot.
Yeah, where is the chat box?
Right there.
In my window, it is in the lower right corner. You can see enter chat message here.
This is Emily. I do see a question in the chat box. As a provider, how often are you asked to alter or addend the chart? And I would say very rarely. I can think of maybe 3 occasions in the last 5 years for me where I got something incorrect or inaccurately documented, and the student wanted me to fix that in the chart, and so I put an addendum in. The other clinicians in the clinic report it once in a while that somebody has asked them to add something to the chart note, but it is actually quite unusual.
Great, and we got another question that I can see, and I actually couldn't see. So there are other ones that people are. Feel free to just read them off. We got questions for Gibson. Your patients have the ability to download the notes into something like Apple with practice partners now.
Jeff, I couldn't hear that very well. It was downloading the note?
Yes, so to Apple Health. And what that's referring to is Apple Health Records functionality within the Health app on iPhones. Apple actually has the ability to pull from EHRs like Epic and Cerner and a few.
I don't know about that from our current EHR. I was assuming that they were downloading into a PDF or into a Word document, so I don't think it actually migrates it to another system, but point and click may be different. We'll find that out.
Great. Next question is from Gavin O'Connor. He says, are any of the patient portals using OpenNotes allow patients to access the notes via a mobile app? So I think that's possibly a similar question.
So this is Deb from OpenNotes, kind of the broader focus on this, and I'm not sure about point and click, what it will be with point and click and some of the specific student health vendors. But Epic, for example, we know you cannot currently access notes via mobile app. Stanford did do their own working on the system so that it was able, but it is not a basic functionality available through Epic right now. They're working towards it. Some of the other vendors, I believe you can. I think you can possibly in Allscripts, but I'm not positive. The major vendors we know right now that have the functionality for OpenNotes are Epic, Cerner, Allscripts, ECW, Editech, and to some degree Athena. We've heard some. So I know Epic right now you can't. I'm not 100% sure about the others.
This is Emily. Point and click says yes, will be available through the app.
Notes, progress note, right? Just progress notes.
So we have another question from AJ Olson. It says, do you become worried unnecessarily about functionalities and lab results that are otherwise not relevant? For instance, a mildly elevated MPV on a CBC result.
This is Emily. Yeah, that comes up once in a while. That's why we do review, and we have a little, we send out reporting labs that are essentially normal, nothing to be concerned about. And so we are essentially explaining that those things that might be a little out of range, which is common to the CDCs, are not clinically significant. So we try to reassure before the worry surfaces. We'll get the question back, what does that mean? But again, just surprised at how little people worried about it.
Sorry, Sorry, Emily. I think the that got cut off. You're saying you were surprised how. And by the way, if you're not
How surprised at how little people worried about the out of range lab values.
Next question, also from AJ Olson. Do you use the terms morbid obesity in your notes or other verbiage as to not possibly offend them?
This is Emily. We are using morbid obesity problem list in the notes. We have all the problem lists in every note, so major problems are listed there, so patients are seeing that. I will tend with people that I think are pretty sensitive about it, I will tend to go with a problem that's simply overweight than using the term morbid obesity or obesity, but I don't ignore it.
Yeah.
So that's how we handle it.
To add another point about that, this is something that came up early on. This is Suzanne. Early on in the first survey, and we had several comments said that they were in their text.
That's right. That's right.
Sorry, just another reminder for folks, if you can mute if you're not speaking, that'd be very helpful. Thank you.
Okay, me too.
Yes. What I was trying to say is that in talking to some of the providers that were participating, they said that when patients express concerns about comments in the notes, such as diagnoses of obesity, having an opportunity to have discussions with the patients about what that meant, and also talking about weight loss options that were available through the health system. Conversation starter is exactly what we would hope for with OpenNotes.
And we did get a request to share the slide again in the emails, so I have it here on my screen. I think when I'm presenting, I'm not able to see the chat box, but so if there are other questions, feel free to read them out, Emily.
What did I eat? Everyone needs to eat.
So I'm not sure if there are any other questions, but here is everyone's email who spoke on this webinar. It's a very exciting time, both for OpenNotes and for college health in general, as students become more empowered with their health records. And if you have any questions about the presentation, feel free to email any of us. The slides and recording will also be disseminated to registrants after the call, so you'll be able to see them there as well. So if there are no further questions, thank you everyone for joining, and have a great rest of your Thursday.
Thanks, Jeff.
Thanks, Jeff.
Thank you.
Thank you.
Thanks, Jeff.